Hi everyone! Today's video is going to be about different exercises you can do on the Swiss ball, or physio ball as some people call it. It's this thing that I'm sitting on. And anybody can do these, but they're really helpful for people who are pregnant, especially as you get towards the end of your second and into your third trimester as the pregnancy, as the belly gets quite large and it's hard to engage the abdominal muscles for stability as you might in more traditional exercises. These can also be meaningful in terms of helping to maintain your strength and mobility during pregnancy, which has been shown to have a faster and easier labor and delivery, as well as a better recovery postpartum, including for the pelvic floor. So for those of you who have already watched my pelvic floor videos or have already seen a pelvic floor physical therapist, I'm going to be mentioning some cues about Kegling and reverse Kegling. If you're not familiar with what that is, that's okay. These will still be beneficial for you. I'm also going to give some disclaimers about certain things to avoid as we go through these. So let's get started. So these are called anterior and posterior pelvic tilts. I'm tucking my tailbone underneath me and sticking it out. Here's another view from the side. And the key here is not to use your legs to move the ball. And these are some side-to-side tilts, like you're lifting your hip up towards your rib cage. Again, trying not to use the hamstrings or the legs to move the ball. Once you have the hang of that, you can try to use them each segmentally in this little square motion. So hitting all four corners. And then you can kind of smooth and round it out into pelvic circles. Make sure you go one way and then the other way. Totally normal and common if one feels more accessible to you. Next we have some marches, and so these are going to start very easy and simple, just marching one leg at a time. You can put your hand on your belly if it helps you engage your abdominals. You can make it harder by touching the ball with your fingertips or eventually not touching the ball at all and lifting the opposite arm, opposite leg. In this exercise, it's really important to hold the belly in like you're hugging the baby. And if you're capable of doing a Kegel in this motion, add that too. Next, we have a series of leg lifts. So you're resting against the ball and lifting the leg. You can either do the leg bent, which is easier, or the leg straight. You can also just do a simple side plank, a modified side plank against the ball. But with all of these, it's important that the ball is against the wall. To make it harder, just increase your angle out to the side. If you don't have a diastasis recti, you can also do a front plank. Next we have ball wall squats. You can cross your arms or have them resting, hands against the legs. And you're leaning into the ball, and you can go as far down as you feel comfortable and safe going. You don't have to go as far as I'm showing here. This is another good activity for hugging the belly in and doing a Kegel. If you're more advanced, you can do the overhead with the ball. This just adds a little bit of an extra challenge. For a nice stretch, you can just do a side bend here. This can help with round ligament pain. This is a supported bridge, again with the ball against the wall. Make sure that you're cleared here by your physician to be doing exercises on your back like this. This is a nice modified child's pose, just letting the belly rest between the legs here. You can also do a deep yoga squat if you have that mobility, resting arms on the ball. Finally, we have a rolling forward hip flexor stretch combined with a backward hamstring stretch, again based on your mobility and your comfort level. Thank you so much for watching this video. I really hope that this helps, and please feel free to leave any questions or comments below. Again, make sure that you're cleared by your medical provider to do exercises, specifically ones that involve laying on your back or being in a plank position. Please consider sharing this video, especially to those people in your life who might appreciate a pregnancy exercise related video that has trans-inclusive language. Thank you again.